Hi there, Dr. Kosterman with Kosterman Chiropractic in Cary, and I wanted to talk to you a little bit about how we treat or address a lower back a disc injury specifically in our office. I think we're probably best in town at this, but I think it all begins with taking a thorough consultation with you, the patient, when you come in so we can find out exactly what's going on. So if doctors would simply listen to their patients, they'll tell them everything they need to know. So we always sit down in a quiet room so you can tell me everything about this injury. Let's make sure you're in the right place. Once we do that, we're going to do a thorough exam to move into where exactly the injury is in the disc, right? So an examination, some orthopedic tests, some neurological testing as well. Then we can pinpoint exactly what's going on. I like to get a set of digital x-rays if we can. It takes a few seconds. Then we can look in there and see if there's any degeneration or any squishing of the disc. Sometimes those x-rays can give us valuable information immediately, so why not do it? Oftentimes, patients will come in with an MRI, and sometimes we'll order an MRI if we need to. That'll show us exactly where the disc is pushing on which nerve and how bad it is. Once we get a good game plan and we find out that this place is a good fit for you, then what we're gonna do is we're gonna develop a plan, right? So if there's alignment issues, we're going to address the alignment issues with chiropractic care. Gentle adjustments, especially if you have a disc herniation or a disc bulge or a disc injury, you know it hurts. It hurts to sneeze. Sometimes it just hurts to smile and chew. You know what I mean? Especially if you've had a disc herniation in your neck, in your back, it hurts to cough, sneeze, or laugh. So we're very gentle and we're very mindful. In the beginning, I'm gonna send you home with an ice pack because if your disc is herniated, you need to be using ice, you don't need to be using heat. It's gonna help with the swelling, it's gonna help with the pain, and I'm gonna give you some very specific positions to get into to get pressure off of the disc. I always say, before you rebuild a house, you have to put the fire out if the house is on fire. So we have to get your pain and inflammation down so we can go to work rebuilding your spine, right? So in the office, we'll do those gentle adjustments and some therapy if we need to, some electrical stimulation and or a roller table if you can tolerate it. But one thing is that's really been a game changer in our office is what's called non-surgical spinal decompression, right? So there's a surgical decompression where they go in your spine and just kind of cut off the back of your spine to create some room for the disc herniation. They do nothing with it. Seems to come back. We do non-surgical. So if you have a disc bulge, so this is the disc in between, these are the two bones, this would be the nerve hole, and it lives in this window back here. That's where it needs to live. So if that disc pushes out on that nerve, that's gonna hurt. So it's compressed and it's squirting out onto that nerve and that hurts. If it's in your back, it goes down your leg. If it's in your neck, it can go down your arm. So we wanna do the opposite. We want to decompress this area, right? So you decompress it, right? Here's a really good model. So let's say you have a disc herniation here. What we want to do is we want to decompress that area and open it up. And over time, we imbibe fluid back in that disc, create a negative pressure, pulls that disc herniation back in, and then you have more of a space between those two bones so that nerve feels better. That all happens on this table. This table is connected to a computer, and the numbers we plug in the computer are dependent upon you, where your disc is, how much you weigh, and those different parameters, how high the table is, where we want to target. So it's all specific to you. You lay on the table, it takes roughly 12 minutes, sometimes a little more, sometimes a little less, depending on how much your muscles fight, but it's gentle. It's not a big pull. It's not like two sumo wrestlers are trying to pull you apart. I know sometimes you feel like that's exactly what you want. You just want someone to like yank on it and pull. That would do more damage than good. So it's very subtle. It pulls, it builds, it holds, it relaxes. So it's gonna do this over the course of roughly, 12-ish minutes. The table opens up a little bit. You're strapped in nice and easy. You lay on your back most of the time. You have some bolsters under your knees, and it's very gentle. You're always in control. You'll always have this little red button in your hand. You hit this button at any time, the table's gonna cut off, my staff's gonna come running in here, right? And they're gonna reset it or check on you and see what you need. But we found this to be very effective at disc, whether it's in the lower back or your neck, right? So since we've got this therapy, I don't have to send patients to the surgeon for consult anymore. It's very effective, it's very gentle. I think we're the best in town. I got certified in 2011 with Kennedy Decompression. We've been doing it ever since. And we would be honored to help you if you are struggling with the disc problem and you want to avoid needles, knives, and surgery and things like that. So we are very conservative in what we do, and we have a specific protocol on how to get your disc healthy. But if you need anything, let us know. We'd be honored to help. Simply call or walk in the door. Thanks for watching, and we hope to see you in the next video.